The purpose of the SNSI Rescue Diver course is to develop the ability to identify situations which could turn into an accident and resolve them or think ahead to prevent the accident itself. If it was not possible to prevent the accident, the SNSI Rescue Diver has to be able to perform proper rescues suited to the emergency situation. A good rescue diver must have well-developed psychophysical abilities in order to face the several kinds of emergency situations. When managing an underwater emergency, the first aid techniques learned during the basic life support first aid diver course must be applied. As you know, CPR is very difficult, both from a physical and psychological point of view. First aid skills are crucial because the more familiar you are with the procedures, the less physical and psychological stress you will feel in a real situation where your help could be vital in saving a human life. Proper dive planning, periodic maintenance of the equipment, an objective assessment of you and your dive buddy's skills, and calm acceptance of interrupting the dive or limiting the depth or duration of it all minimize the possibility of accidents. When an accident occurs, the rescuer's reaction can determine its outcome. Anyone carrying out a rescue has to make the right decisions and act promptly. You must be aware of the primary objectives that every rescuer must take into account when managing an emergency. Rule number 1. Do not put your own safety or other rescuers at risk. Then, distance the victim from the dangerous situation. And lastly, minimize the physical damages from the accident. When facing an accident or difficult situations, good rescuers stop, breathe, think, act. If you find an unconscious diver below water, the first thing to do is to observe the scene. Does the diver have the regulator in their mouth? Is the diver truly unconscious? Is the diver breathing? Is the diver's mask correctly worn? You may need to shake the diver to make sure whether they're conscious or not. The situations must be assessed in a few short seconds. Then make contact with the injured diver and get back to the surface. Before resurfacing, turn the diver in distress and deflate the air in their BCD. Loosen the right shoulder strap to put your arm in and place your hand on the chin of the diver to help keep their head straight so that your fingers can press their dump valve to try and somehow supply them with a little air. Resurface with your BCD and your legs in order to control the speed. Remember that your safety is crucial. While resurfacing, press the dump valve of the second stage of the injured diver every 4 to 5 seconds. Do not worry about the expansion of the volume of the gas. An unconscious diver with their head in an upright position has their airways naturally open. Therefore, the air that expands in the lungs and in the airways will exit by itself. As soon as you reach the surface, remove the injured diver's weight belt to assure buoyancy. Do not inflate the diver's BCD. Inflate your own BCD to assure buoyancy. Take off the diver's regulator and mask. If you are wearing a hood, take it off so that you can hear. Open the victim's airways and put your ear near their mouth, looking for any chest movement while you listen up to 8 to 10 seconds to check if the person is breathing. Call for help. If you are alone, telephone for help. Take the pocket mask for artificial respiration, which all rescue divers must have as part of their personal equipment. Position it and begin artificial respiration. Begin with 2 insufflations then one every 5 seconds. To help keep time, count 1001, 1002, 1003, 1004, and then blow. Between one insufflation and the next, remove one strap at a time and take off the injured person's scuba unit. While carrying these steps out, you need to transport the diver to the boat or the pickup point. Remove the diver's BCD, unhook their belt, and take off your own BCD while keeping the same rhythm of insufflations and while continuing to transport the injured party. If you get distracted and lose count of the rhythmical insufflations, start over with 2 consecutive blows. Do not ever allow more than 8 seconds to pass between one insufflation and the next one, and do not lose the rhythm of the insufflations. Move around with awareness and manage your energies. If you rush, you will not be able to successfully finish the rescue. Always keep your hand with the thumb towards the waist of the diver you are rescuing under their neck to support them and open the airways at each blow. If the dive began from a boat, after reaching for the platform, you must interrupt the artificial respiration to take the injured party aboard. The crew should be trained and therefore able to help you. If the boat has a platform near enough to the water, place the injured person's hands on top of each other on the platform and keep them still while you board. Keep the diver's hands still, take off their fins, and hoist them on the platform. Be careful not to bump the diver's face or head on the edge of the platform. Rest the diver's body gently and turn them over with the techniques you learned in the BLS First Aid course. Once again, check their breathing. If they are not breathing, call for help and begin CPR.
Aiuto, aiuto, c'è un subacqueo incosciente che non respira, chiamate soccorsi, aiuto!
If you find a diver who appears to be unconscious on the surface, after having verified that they actually are, turn them over and take off their weights. Inflate your BCD well anytime you carry out any type of rescuing in order to assure your buoyancy. Do not inflate the injured party's BCD. If you inflate the BCD of the diver you are rescuing, the equipment will cause chest constriction, which will make the insufflations ineffective. When practicing this exercise with your course mates, remember that it is prohibited to perform insufflation on a person who is breathing. You must use the pocket mask and position your mouth correctly around the opening, but blow without closing your lips around the tube of the pocket mask. The insufflation should last a couple of seconds to be valid. Respect the rhythm of the insufflations while you strip both the victim and yourself and transport them towards the exit point. If you exit from the beach after having reached for a point where you can walk the bottom, you need to take off your fins and place the injured party on your shoulders to pull them out of the water. Once you are out of the water, check once again that the diver is breathing, and if they're not, call for help and then immediately begin CPR.
Aiuto, aiuto, chiamate il soccorso,
In every diving test, when it comes to rescue and first aid, the indications always include administering pure oxygen. A few important considerations need to be made about this. In some countries, including Italy, oxygen is considered a medicine which may only be administered by medical personnel or skilled paramedics. In any case, it is sure that administering pure oxygen to a victim of an underwater accident is the best first aid that can be provided. This is the reason your instructor will show you how to use a kit for administering pure oxygen, an exercise which is also taught in the SNSI Open Water Diver course. You will learn how to manage and administer oxygen to an underwater accident victim who is able to breathe independently, and how to add oxygen to insufflations to help those who cannot breathe through the use of the pocket mask. You have successfully concluded your rescue diver course. If you are a Nitrox certified diver and you have at least 50 dives recorded in your logbook, you can ask your instructor to complete the Master Diver SNSI license. The Master Diver SNSI license is proof of your experience and it certifies you as an expert skilled diver. Any diving center you visit where you present your Master Diver SNSI license will immediately allow you to demonstrate your diving experience at a high level. Are you ready for the next big step? Take the challenge and become a professional SNSI. By signing up for the SNSI Dive Master course, you will be giving yourself a chance to change your life. The sea can become your office, and you can become a group leader and accompany your diving buddies on 1,001 adventures. The challenge continues. Dive up your life.